Good evening, ladies and gentlemen. Welcome to the webinar entitled The COVID-19 Pandemic, Mitigation Strategies and Hospital Management, Sharing Korea's Experience, organized and hosted by Seoul National University Hospital, SNUH, and the Korea International Medical Association, KIMA, and sponsored by the Korean Ministry of Health and Welfare, the Korean Ministry of Foreign Affairs, and the Korean Healthcare Industry Development Institute, KIDI. My name is Kyung Park from Seoul National University Hospital in Seoul, Korea. I would like to welcome all of you from around the world. I believe we have several friends and colleagues that are tuning in from the 10 ASEAN countries and other Asian countries, a few European countries, and from our Middle East colleagues, including UAE and Kuwait. In particular, I would like to let you know that this webinar is part of the follow-up on the ASEAN Plus 3 Summit's special agenda on the COVID-19 pandemic. As you well know, the entire world is struggling to fight the COVID-19 pandemic with approximately 2.5 million confirmed cases worldwide since the first case diagnosed in November of 2019. Korea's first case was diagnosed on January 20th, and we also had a major outbreak in the Daegu, Gyeongbuk province from late February. Fortunately, however, Korea has been able to bend the curve with aggressive social distancing, but without any lockdown of the country. We have had less than 50 or so cases per day for the past 17 days, and about 10 or so cases for the past 4 days now. We have prepared this webinar in order to share some of what we have learned during this battle against the virus, and also to learn from you with hopes that it may help us better handle the situation that we are facing in our respective countries and hospitals. We have 4 presentations today. The first presentation will be about how SNUH as a hospital system has handled this pandemic. The next talk will cover the diagnostic aspect of COVID-19, sharing our laboratory medicine experience. Then the third talk will be about the clinical aspects of pediatric COVID-19 cases, and the final presentation will deal with the clinical experience from our adult cases. After all 4 presentations, we will have a Q&A session with myself and all of the speakers. Please be reminded that you can post your questions as a comment on the chat function, and we will try to address as many of the questions as possible after the talks.